some of the biggest challenges right now is that healthcare is evolving so quickly, and a lot of hospitals just don't have the resources to keep up with that. And really what Medline can do is work with facilities to keep up to date, to keep best practice top of mind, and also provide the best possible care for their patients.
We actually help in every care setting, so that includes long-term care, skilled facilities, rehab hospitals, LTACs, as well as home health and hospice. And our main goal is to help with that education and training, which now is more important than ever with the staffing issues that we're seeing. We help educate from a holistic approach, and that includes process, people, and products to help create that synergy with our system.
I think our clinical service team is one of the most diverse support teams out there. We have backgrounds in all sorts of different specialties. We have certifications across the board. We have people that have worked in healthcare for many, many years. I think we're at 680 clinical years as a group. Any challenge the customer may have, Medline is equipped to support them.
My first day in Medline, I came right out of the operating room. I was a Medline customer, and the operating room is a very complex environment. The Medline products that they use today, it's important that we build in best practice for them. So as staff's turning over, as new surgeons are coming, as residents are gaining new skills in the operating room, those practices are built into their programs.
The clinical service team really tries to understand what's at the root of the problem, so it's not just here's a product, here's a couple of posters you can use. They really try to understand what's happening at the point of care to then make a solution, both product and education, to help support our customers through their challenges.
One of the nice things is that we have the ability to really tailor their education based on what the customer's needs are. So they're able to empower the caregiver by providing them evidence-based type of education. And when it comes to that, they're able to do it on many different platforms. So we can provide virtual education, we can provide live education, we can go in and do boot camps specific for that customer's needs. And then we're able to hit at the variety of skill levels. So whether it's the caregiver at the bedside, whether it's the family members, all of our education is based on their learning styles as well.
We work really closely with a lot of organizations to really understand what the evidence is saying and what those organizations are recommending for care. Our clinicians do spend a lot of time looking at research, looking at these guidelines, making sure they understand what the best practice is. We have team members across the country in many different states.
Knowing that we have a team of dedicated clinicians that can go in and really support to help them gain the same outcomes that we want and that we're trying to drive as well too.
We want to make it easier for caregivers to do the right thing.
I have never seen a team get in as deep in the trenches as this team does. For me, that makes me very proud to work here.
We are nurses, we are techs, we are clinicians as a team, and we want to help you.